beats me.
Computers aren't capable of human emotion, Epiphany.
Tell that to Mr. Spinelli.
Come on, all new programs are intimidating. Just give yourself a couple days on it and you'll have it purring like a kitten.
I'm allergic to cats.
Hey, has anybody seen Robin?
She was just here. Actually, she just got out of therapy and she was looking for you.
Oh, well, how'd she seem?
Why don't you ask me yourself?
Hey. So, how'd it go?
I thought you'd be waiting for me right outside Dr. Brown's office.
Yeah, I was going to, but when I almost bit Matt's head off, I figured I should take a breath of fresh air.
Where'd you go?
Went over to Jake's.
Well, that's nice. Did you play some pool?
No, I thought about it, but then I just ended up talking to Coleman for a while.
About me?
About me.
That's interesting. You get a bartender and I get a shrink.
He's not just a bartender, he's a friend of mine, and he was my best man at our almost first wedding. Yes, he does have a unique view of the world.
You say unique, I say strange.
Listen, if you want me to go to one of your sessions at your therapist, I will. If you think that'll help.
I'll think about it.
Okay. Because we're good together. And I want to get that back. I want to do whatever it takes for you to get well.
I guess Coleman's all right. I want that too. You're my life. You and Emma, and I'm going to do everything I can to get better. I feel like I'm getting better every day.
Good. Because that's what I want to hear, that you trust your therapist, that you trust your meds, and that you can trust me again.
So how would you feel if I scheduled my appointments with Coleman instead of Dr.
Hey,
Brown?
Coleman has some good advice every once in a while. It's just his use of the word dude kind of lessens his credibility. But I'm serious. If Dr. Brown is the problem, we can find a new therapist. Laney gave a bunch of referrals. I actually ended up
hold
calling
on. I know that you're trying to be supportive, but this is where we always disconnect.
Okay. I just want you to be comfortable.
I admit, I don't like Dr. Brown, but I don't think I would like anybody under these circumstances. So for the time being, I'm willing to stick with her.
Okay, but remember you have options, all right?
I think I can get better, but I need you to be patient with me.
Okay, I will. And I need you to be open with me. Let me know how you're feeling, because I know that we can get through this together.
Desert Storm or Hearts and Flowers?
A little bit of both, but I'd still give them plenty of room.
I'm gonna keep my flight jacket on just in case.
Head trauma just arrived in the ER. They need to assemble a team stat.
Well, the rotation is pretty thin. The only available attendings are Robin and Patrick.
They can't work together. They can hardly be in the same room. Yep, go ahead, book over to. I'm requesting Elizabeth Weber and Epiphany Johnson on my team. Yeah.
You can't perform the craniotomy.
Are you questioning my ability?
No, your political sense. The mayor is coming in, and he has specifically requested you as his physician.
Oh, the mayor tore his ligament. Any nurse can handle that. No offense, but this Donald Lynn, he needs a craniotomy, and Patrick and Robin are in no shape to handle it.
Oh, you got that right.
For Epiphany, find me an anesthesiologist, and we'll get this show on the road.
Hey, is that the head trauma from ER, Donald Flynn? Just reviewed his scans. The hematoma is minor. I'm going to prescribe stereotactic fibrinolytic and hold off surgery for 24 hours.
What is the Donald Flynn chart? I just spoke to ER, and the patient needs an emergency craniotomy. Epiphany, can you book an OR, and we'll get a surgical team to scrub in?
What do you mean, we? No offense, but do you think you're really ready to sit in on a surgical team?
Well, Dr. Drake wields the scalpel. I'm just there to lighten his load.
This isn't necessary. I can do this procedure without you.
Oh, are you kidding me? This is exactly the excuse I needed to avoid them there. Besides, you know if I'm not in that OR, Robin's liable to get hands on.
Robin wants to assist.
Robin doesn't know what Robin wants. And if the patient hadn't had complications, we would all still be standing in the hub having this debate whether this patient actually needed
Difference of
surgery.
opinion, isn't it?
Your marriage is a train wreck and it's starting to affect your professional life.
I'd never allow myself or Robin to get into an operating room if I thought it was going to jeopardize the patient.
And don't get me wrong, the two of you are good doctors, all right? It's together that I worry about.
Now, we've done this a dozen times.
No, not like this. All you have to do is look at each other the wrong way or offer an opinion. And if you two get into it with the patient on the table,
Look,
I
that's
swear.
not going to happen, all right? Do this procedure with my eyes closed.
Oh, yeah, that's a good idea. That way if something goes wrong, you'll have an excuse if you get sued for malpractice.
Okay, I'm in.
Can you see the bleeder?
Not yet. You know, if Mr. Flynn's condition hadn't deteriorated, he would have been an excellent candidate for fibrinolytic drug protocol.
Well, it's nice that you finally warmed up to my supportive drug therapies, Dr. Drake, but I am relieved that your surgical skills were available when Mr. Flynn needed them.
There's the hematoma.
Okay, let's evacuate forceps. Okay, clamp it off.
Yeah, I can't. The vessel's frayed.
He's tachycardic and his BP's dropping.
I can't see if there's too much blood.
Suction irrigation.
BP's 80 over 50.
He said he runs a VTAC.
Give him 150 amiodarone push and hang the blood wide open.
Nurse suction here.
We're out of time. We gotta find the bleeder.
Nope, 30 seconds.